test, we're using the American Thoracic Society guidelines for the 6-minute walk test. So this test is to be conducted inside, obviously probably in like a hospital hallway, a low traffic area, which can be sometimes challenging in most hospitals to find an appropriate area for a 6-minute walk test. You want to have a minimum of 15 meters to 45 or 45 feet distance course set up, because you don't want it to really be less than that, because the patient could get dizzy as they're going back and forth. And then you want to make sure that you have a stopwatch, colored tape, or if you're using cones, you want to make sure that your cones are set up about a foot in from like the course that you measured out, just to allow for that turn distance that they would need to walk around the cone. You want to have a tape measure, or we use like a trundle wheel to measure the distance. And then you want to have a wheelchair, something to bring the patient out to the course. So before you get the patient like set up, you want to ask them if they want to wear tennis shoes or if hospital socks are okay. They might have a preference, but you want to make sure that they're comfortable and have the appropriate walking aids, such as their cane or rolling walker. And then you want to get them in the wheelchair, which if they're in the bed upon arrival, you can go ahead and go through the FSS ICU and score that, and we'll go over that in a minute. But the FSS ICU walking distance can be integrated into the actual 6-minute walk test, and so we'll go over kind of how to do that as well. Obviously, since this is a standardized test, you want to read the exact script that is provided there in the italics and bolded. Obviously, you want to remind them not to run or jog, and then ask them if they have any questions before beginning the test. You want to demonstrate the course so that they know how far down the hallway that they're going to have to walk and turn around. Then there are standardized verbal instructions for each minute of the 6-minute walk test, and we ask that you stick to these standardized verbal instructions so that all sites are doing the same thing when instructing for the encouragement. So at the start of the test, you're going to start the timer when they begin walking, and they are allowed to take a sitting rest break, but you cannot stop the time during that. During their first sitting rest break, you want to mark it with like a post-it note or like something, because that's going to be their walking distance for the FSS ICU. And then if the patient does sit in the chair, you want to give them standardized encouragement every 30 seconds, saying please resume walking when you feel able. And again, that's every 30 seconds that you're providing that verbal cue. And then if any like actual clinical concerns come up during the 6-minute walk test, so say the patient starts having chest pain, you do want to contact the PI or the co-PI just to get guidance on whether to continue with the test or not. But the time continues during that as well. And then you would report the reason for stopping the test. Okay.